note that this session is going to be recorded and made available via the WINS Network website. By staying on this call, we understand that you provide your consent for the recording and sharing. The session for today is entitled New Models of WINS Engagement, Hand Washing Facility Designs During the Pandemic. If you have joined us in any of the other sessions, welcome back and thanks for being here with us again. I am Marge Lim of the WINS Network Secretariat, and I have the pleasure of opening the session for today with a brief introduction of the WINS Network. I'm also joined by my colleagues Fred Madrid and Piata Mendova, who have been strongly supporting the coordination and preparation for this event and the entire webinar series. Over the next hour and a half, you may see either of us posting reminders, links, etc. in the chat. So yeah, we encourage you to actively engage through the chat box, and please continue typing in your name, organization, and where you're currently based. Yeah, we'd love to know who are joining us today. And now, please allow me a few minutes to introduce the WASHaLOT schools or the WINS Network. Next slide, please. So the WINS Network is a global interagency network that is working towards improvement of WASH services in schools across the globe. And in order to do that, in order to help inch closer towards this goal, the network facilitates exchange of experiences and alignment of strategies among various organizations in support of government's Wash in Schools program. The network is steered by the core group members, namely UNICEF, GIZ, Save the Children, WaterAid, the WHO UNICEF Joint Monitoring Program, London School of Hygiene and Tropical Medicine, Emory University, and UNESCO. The WINS Network's activities are focused on various working streams, namely the one you see on the blue box, advocacy, policy and system strengthening, monitoring and reporting, research and evidence building, gender, including menstrual health and hygiene, WINS programming, knowledge management, capacity development, learning, and exchange. If any of these initiatives is of interest to you or is aligned with the work that you are currently doing, we invite you to continue the exchange with the WINS Network either as a member or a partner organization. So as a member, you will be part of our mailing list and receive regular updates on the WINS Network's activities. If there are events such as like what we have right now, there will be calls for contribution, thereby providing a platform to share best practices within your area of work. There's no active engagement required, but would of course be most welcome. You may also check out the website www.winsnetwork.org for more information. On the website, you may also find upcoming and past events on WINS and a collection of relevant materials and information about WINS, including global guidance documents or resources, publication in peer-reviewed journals, and there's also a Wash in Schools and COVID-19 knowledge map available. If you have any question around membership, please feel free to place them in the chat and we will address them as soon as we can. I will also post a link shortly to the member registration form for those who are interested to become a member of the WINS network. So here we go. And now let us move to the next part of the program. I request us to move to the next slide, please. And at this point, I will now move on to turn the virtual stage over to our session moderators. So that's right. For today, we have two co-moderators. And please allow me to introduce them, starting off with Belinda Abraham. So Belinda Abraham is an American national and an international development specialist with over 25 years experience in the WASH and education sector in Sub-Saharan Africa and Southeast Asia. She has worked with UNICEF, GIZ, and several international NGOs in 7 countries. Belinda is currently based in Berlin, Germany, supporting the Global WINS Network Secretariat and also Viva Con Agua on institutional fundraising for their projects in Africa and Asia. Next, we are happy to be joined by Tedei Tamir. Tedei is a Water Sanitation and Hygiene Officer at UNICEF's Regional Office for West and Central Africa, and focuses on WASH in institutional settings and menstrual health and hygiene. She has spent the last 4 years working for the regional office, first as a UN volunteer on the gender team, then as a consultant for the WASH section, focusing on WASH and institutions and menstrual health and hygiene. Previously, Tadej worked in gender programming, knowledge management, and public health research. An Ethiopian national, Tadej holds a bachelor's degree in physiology and international development and master's degree in public health from McGill University and the University of Eastern Finland, respectively. So without further delay, I now turn over the virtual stage to you, Belinda, and Tadej. Thank you very much.
Great, thank you, and glad to see so many faces and also that so many people from all over. Really glad that you are all here with us today. So, and I'm really pleased that I get to co-moderate this with Tadej, and in between the idea of this session is we'll have 3 great presentations. I've seen a little bit of them already, and I think they're chock-a-load with information and innovation and lots of great ideas and also sharing. And I think that's the whole point of the WINS network, as Marge has already said. So without further ado, let's begin with our first presentation, and it is in the wee hours in the morning. Way wee hours in the morning, but I am pleased to introduce Roswell. Roswell Thomas he's working with HappyTap as the partnerships director and for East Africa and also the Pacific region. He's also worked on a HappyTap business development projects in East Africa and the school sales, which actually very interesting was also in the US and the UK, because oftentimes we think it's only in the global South, but very much this has been a product and program in the global North. He joined HappyTap at the start of the pandemic, so that couldn't be a better orientation to a job than to start in the pandemic. He's been 10 years into consulting firms, market-based development initiatives, including financial inclusion, environment, agriculture, and of course, water and sanitation. And prior to HappyTap, I think that's where I got to know you first, Roswell, was when you were working with the fantastic organization 17 Triggers, doing behavioral change and marketing consultancy. So very pleased today to have you here and on board. And the last point I say before I give you the stage in these wee hours of the morning for you is that I remember this kind of inception of the idea in Cambodia, and when the London School of Hygiene and Tropical Medicine actually did a presentation on neonatal health, and this is kind of where the HappyTap was born. So I find that fascinating and look forward to hearing more from you. So the virtual floor is yours, and yeah, welcome.
Thanks very much, Belinda, for the warm introduction, and thanks everyone for having me here today. It's fantastic to be here. In this group, I joined some of the previous webinars in this series. They were fantastic, and I'm glad to get in for the last one. And also particularly excited to be here in the company of some other innovators in our small but growing school hygiene industry. So I'm really looking forward to hearing from SATO and from WASHaLOT as well. So the HappyTap's been around for about 10 years. I actually grew out of a USAID project called Watershed back then, and then it was my introduction to it through a LSHTM neonatal health project. It really helped us out with some behavior change work there. I'm a little new to this space, as Belinda said, having joined at the start of the pandemic. So if you'll forgive me, I'll start this presentation actually where I started my WASH in Schools journey, which is with behavior change. And specifically an elephant, a rider, and a path, which is one of the simplest behavior change frameworks I've found, but actually one that's powerful enough to encompass the nuances of tools like Sanifoam or behavior-centered design, though it doesn't necessarily unpack all of them. Basically, the rider is the prefrontal cortex, which thinks it's in charge. The elephant is everything else going on in our heads, which is a lot more powerful from a behavioral perspective, and the path is the context how easy the behavior is. So looking around at WASH in schools from this perspective, it's really easy to categorize them into, rider messages that are logical, elephant messages that are more emotional, and then path interventions. We saw during the pandemic a lot of very logical reasons to wash your hands. Wash hands often with soap and water for at least 20 seconds because the CDC says so. We'll wash your hands frequently in Cape Town there. Many hundreds of millions of dollars were spent on interventions like this. And that's a good first step in behavior change. You need to give people a logical reason to do the behavior. That's speaking to the rider. But of course, that's usually not enough. We all like to think the rider is in charge, but if the rider were in charge, we'd all eat healthy, we'd all save money, we'd all exercise every day, and no one would smoke cigarettes ever. So we get into these more emotional messaging to, as we say, motivate the elephant, the big, strong, less than rational thing that drives our decisions. Sometimes we call that the reptilian brain. It's the messy tangle of group identities, emotional motivations, and good old-fashioned habits. So that's a shame-based advertisement on the left that 17 Triggers did, built on good old-fashioned CLTS. Bottom right, you have the PPAP guy singing a mind-numbingly catchy tune about hand washing. And of course, in the upper right, Dwayne "The Rock" Johnson washing his hands with his daughter on Twitter during the pandemic. So again, logical motivations, emotional appeals, and then the third thing that we have to do to change behaviors is make the path as easy as possible. And that's the context, as simple as possible. So all of us here, we all know we should wash our hands before we eat. So our riders are informed. I think our elephants are motivated. We all work in the wash sector. Washing our hands before I eat, I think, is part of all of our identity to some extent. I know it is for me, but I guarantee all of us are much more likely to wash our hands going into the restaurant on the left, where there's literally a sink by the door in your path, as opposed to washing our hands in the restaurant at the right, which doesn't have a sink so much as a tiny little sign pointing to a bathroom even further away. And that comes to my point about WASH in schools. At the beginning of the pandemic, so this was in June 2020, LSHTM released a timely meta review of, I think, over 70 hand washing interventions from around the world. And actually path interventions, making it more convenient, came out at the top of their list. The greatest opportunity to increase hand washing with soap is to provide conveniently located, desirable hand washing facilities with soap and water present. Of course, here, the devil is in the details, especially in our industry. How convenient is conveniently located, right? Particularly in the rapidly changing context at the start of the pandemic, when we were all realizing students and teachers needed to be washing their hands much more often than we thought they'd had to wash them before. One study that was conducted with Canadian healthcare workers is particularly useful, has been useful for us. So this is a study of observed hand washing behavior. Everyone has advanced medical degrees, right? They're nurses and doctors in Canada, so we can assume that the rider is well informed. They've dedicated their lives to helping and protecting patients, so they have well-motivated elephants. And here in this study, there was a big path problem. And specifically, they found that hand washing statistically didn't happen unless there is a hand washing facility within 7 meters and within line of sight of a critical time for hand washing. For every additional meter, hand washing compliance dropped 10%, and you don't want to know what happened if they had to go around a corner to reach them. So with the LSHTM study citing desirability and convenient location of sinks, I'm hoping to see more discussion of this in the research in terms of where are sinks being placed and what do they look like. This is a great box from the GIZ UNICEF field guide for the 3-star approach for WASH in schools. I love this because they're linking WASH in schools to a direct educational outcome, which is reduction of school absenteeism. And for our colleagues outside of the WASH sector and education, this is how we can really get their attention. So I was looking at these studies, 54% reduction in absenteeism by hand washing promotion and soap in target schools in China. Super impressive. I dug into that study. And we're seeing actually all schools had a minimum of 1 tap per every 30 students. Took a little bit of digging, but that was kind of a path foundation that was there. The 40% reduction through twice daily hand washing in 30 primary schools in Egypt. Again, as far as I could tell, there was about 1 tap per every 34 students in that study in terms of checking the box on the path aspect for sufficient facilities. This next one in Kenya was a little bit harder for me to get through in terms of finding the ratio of sinks to students. They gave a student to latrine ratio of 35:1, which is promising. But of course, you know, this study was done pre-pandemic. Post-pandemic, we know it's very clear that it's not just after using the latrine that we need to wash our hands. And so what I'm interested in, especially now that I work for a company that manufactures and places sinks in classroom, is much more discussion of where should sinks be placed in order to be the most effective. And of course, more photos of the sinks that they're using would be great to include in studies like this. In my experience, in our experience, 1 hand washing station per classroom is fantastic. For a couple reasons. This puts sinks within that 7 meters in line of sight. That was a requirement for Canadians with advanced medical degrees. So it seems like a good place to start for busy grammar school students and teachers. And there's some positive externalities to this that I've observed in a couple schools. So first off, while you might be able to skip a sink in the privacy of a bathroom where no one's watching, it's a lot harder to do when you're walking into a classroom full of your peers. They're all staring at you and expecting you to wash your hands with soap for 20 seconds. So this photo that you see here was taken at the first day back of school after pandemic lockdowns, and I'm hopeful that that kind of pressure helped these kids with longer term habit formation. Another benefit to 1 hand washing station per classroom is sort of monitoring and accountability. I think what we saw is group hand washing facilities can sometimes suffer from like a tragedy of the commons. When it breaks, it's not immediately clear who should fix it. And especially at the school on the right, which had an aging janitor, and actually we found out later a history of poor performance with the Fit for Schools program. It's kind of a long story, but we actually meant to send the HappyTaps to another school that had better performance, but they were also named after the Prime Minister's father. So we got confused and we realized the mistake too late. But we were relieved to see that once we gave each teacher a hand washing station, they actually wrote the name of their classroom on the tank. And then it's very clearly each hand washing station is each teacher's responsibility. And so the teachers are getting the students to refill it. And I'm told that the teachers collect a 12-cent late fee from kids that show up to class late, and then they put that in a jar until it's enough to buy soap for the classroom. And it's kind of a mark of pride to have your hand washing station full up, in front of your classroom there. And then I was going into this wondering, how do we get the private sector to invest more in hand washing facilities and the supply chain and the research development and all this stuff that it takes to get a product to market? So we like to talk about another market-based public health issue. Bear with me, helmets. And specifically the case study in Vietnam. So on the left is a picture of Saigon traffic in 2005, right? Lots of people need helmets. Everyone needs helmets in that photo, if you look closely. But somehow it doesn't seem like a good time to get into the helmet business. It doesn't seem like anyone really cares about buying helmets. Then in 2007 came one of the best days in the history of the helmet private sector in Vietnam. I would say, when the government passed strict legislation that mandated helmets for all moto drivers and their passengers. Violators were faced with fines, and these were strictly enforced. The fines were actually more than the price of a helmet. So overnight, you had a thriving helmet retail industry that sprang up everywhere, and you can still see it when you're driving around Vietnam today, all these helmet stands. So imagine if we could do that for hand washing stations as well. I am not saying that we should fine schools for not having enough hand washing facilities. I would be the first to object to that. School administrators have enough on their plate and little enough to work with as it is. But more my point is that a clear, credibly enforced government standard about the minimum number of sinks and how convenient they need to be will go a long way towards unlocking investment from the private sector and realizing that sort of recommendation from LSHTM about a conveniently located, desirable hand washing facility being a huge way to move the needle in terms of hand washing with soap. A couple quick examples. In Cambodia, three-star approach, and again, love what the three-star approach is doing here. A one-star school has this intriguing or and thing. A basic hand washing facility is next to each latrine or and classroom. That's a big difference between each latrine or each classroom. We're lucky that during the pandemic, it seemed to be a lot more schools and a lot more provinces interpreting that as next to each latrine and classroom, which was great for our sales, of course, and also what matters most, great for student hand washing outcomes. And then in Vietnam, another example there is Vihima, which is part of the Ministry of Health. They have guidelines calling for one hand washing basin per 20 to 30 primary school students. That represents a huge potential. It's just that the schools that we talk to don't seem to know that it exists. So that's something that I think we have a foot in the door, but the development sector helping to publicize that and advocate that out to schools is going to go a long way. During the pandemic, we had emergency funding surge, direct procurements, little to no monitoring budget. It was a crazy time. It was an exciting time. Really, but honestly, we're moving into a post-pandemic sort of context where I think we have a lot of exciting gains to solidify as we look towards more sustainable funding, either from governments or from corporate social responsibility and NGOs, hopefully getting competitive procurements and local supply chains as the industry takes off. And also looking to talk about what works in terms of convenience and that being such a big factor for hand washing in schools. So that's what I wanted to share. Here's a quick sort of evolution of the HappyTap from its first sketch back in 2009 to the product we went to market with during the pandemic. And we have UNICEF actually to thank for this extended handle that was a big procurement in Madagascar, and it was really clear to us that they needed something that was going to be low touch, and so that's where we, it was a no-brainer for us to invest in the research and development to get that kind of thing to market, so that they can use their wrists or elbows to operate that. And yeah, I'll stop there. Sorry if I've gone a bit over time, but yeah, thank you so much.
No, fantastic. Not at all. You're right on time. And I think what a fantastic presentation on so many levels. So I'm going to like to, hopefully they can pin in Sirai, if you can join us now. And as you've seen from the chat, Marge has asked that if you have any comments or questions, please put them in the chat box and we will be looking at that. But any initial insights today on this presentation, and then some specific questions. I do have a question for you actually, Roswell, so don't go too far. But Sirai, some insights, please. Just, I think we're having some audio, just, yeah.
Oh, can you
Perfect.
hear me now?
Perfect, yeah.
Okay, great. Okay, so thank you, Roswell, for that really great presentation, and I'm glad that that behavior change is at the forefront. I think you placed it right in the beginning of the presentation, and I think it highlights the point that technology has so much more to do with all these sort of factors surrounding it. In addition to the actual infrastructure. And in Western Central Africa, so UNICEF carried out a study on operation and maintenance and sustainability. And one of the things that we notice is that even when we had an allocation of funds at school level, the operation and maintenance needs were not necessarily met. So there are all these questions that need to be sort of examined around behavior change, I think, at the individual, but also the school level. And I'm happy to note that HappyTaps was during COVID, that we had 2 countries that experimented with it. So it was in Benin and in Ghana, in institutional settings. So I think, I mean, this is a quick review of the COVID response, but I think I can follow up and see how they've kind of maintained these actions. So maybe I'll stop here for now, and over to you, Belinda.
Yeah,
Thanks for that.
thank you. Thank you for those reflections from West Africa too, and also from UNICEF. I do actually want to draw everybody's attention to the very good, if you do click onto our website, the Global Hand Wash Partnership actually had a documentation, a think tank on hand washing, and some of the things that you raised in your presentation are actually there about some of the challenges and taking the momentum during COVID. I have a question though. I love this elephant in the room, the elephant in the room thing. Can you explain how does the group hand wash fit into this elephant rider pathway framework? It was an interesting one, but how do you see it fitting in, or what is this sort of the thought behind that? Thanks.
Yeah, thanks, Belinda. So I was fitting our sort of individual hand washing facility very much into the path on that. Although I would add that it also has sort of an elephant. The HappyTap has kind of an elephant and a rider component. It's been described to me as obnoxiously green, and that's by design because it's eye-catching. You know, it's kind of a visual nudge, getting a reminder there. Group hand washing facilities are great because they also do have that path aspect where it is an opportunity for you to wash your hands, right? So I think it's a great piece of infrastructure. But when you ask, you know, how many times a day do you need to brush your teeth in order to prevent cavities and gum disease, right? It's twice a day. I think we can all agree. To brush your teeth twice a day, you're in pretty good shape. And so I think the path in terms of that group hand washing, that twice a day toothbrushing, you know, is so easy to do there. But then the path for hand washing is a little bit trickier because you ask how many times a day do you need to wash your hands to prevent disease? Is it twice a day? Is it 4 times a day? Is it more than that? And the answer really is you need to wash your hand every time, you know, you need to wash your hands. It just comes up. And so you do need, I think the path for hand washing that prevents disease covers so much sort of individual as well as group occasions. So I think that the group hand washing facility does make a clear elephant appeal in terms of group identity, in terms of a social norm. I think it's so powerful to have kids come together, you know, while they're singing the Pledge of Allegiance, like, you know, every morning and wash their hands and say, this is something that people like us do. This is something that is good. We all get together and wash our hands. And I think that really reinforces the kind of individual hand washing behavior that we're unlocking with the HappyTap. So the short answer is, like, I think that they're complements, and I think that group hand washing facilities are so great for sort of motivating the herd of elephants and setting the scene for those habits. But I would say that, you know, without individual hand washing to complement that, you might be missing part of the picture.
Yeah, well, very interesting and well said. There are a few kind of comments. I don't see so many questions. I have another one again, but somebody is mentioning, I think it's Isaac, talks about the big challenge about getting the best hand washing design that suits context. So, for example, context in Africa, and also having so many in schools. I don't know if you want to have a reflection on the design itself, because you have actually, the design was initially started, I guess, for Asia. Was there any reflections in terms of appropriateness and design when you look at in other contexts in for example, in Africa? I think if that's the question I'm getting from Isaac, or at least the reflection to that. Mm-hmm.
Yeah, thanks. Yeah, Great question, Isaac. So yeah, the HappyTap was originally developed as part of an intensive human-centered design process for households, and most of that field work took place in Vietnam and in Cambodia. That was after, actually, as an NGO, they first exhausted all of the existing technology that could work with a household that didn't have access to piped water. So they left a couple prototypes with households. They came back after a week. They said, hey, do you like it? Hey, do you wash your hands? And everyone said, yeah, I like it. Yeah, I wash my hands, as you would expect. And then the real insight was the experimenters said, okay, well, if you like it and you wash your hands, like, you know, I have to take it back to my office now, but will you give me $1 and you can keep it? And everyone said, no, that's fine. That's fine. You take it away. I'm not giving you $1 for this thing. So that was what sort of triggered us to be doing the, very, very in-depth, making something that is desirable. Back to that LSHTM thing that would come out later, desirable, conveniently located.
Aspirational.
And we were lucky to, yeah, exactly. And we were lucky to be able to do that pre-pandemic, when you could have those face-to-face interactions with folks and not worry about that. So the aspirational elements of it is like, kind of the sleek design, having a basin to catch the water so that you're not washing your hands into a mud puddle at your feet, but you're taking the water and putting it somewhere else. And also the water saving features that we've built into it. It's worked really well in Africa as well. I think some of those things are quite universal in terms of easy to open. The sort of I've had people in Vietnam as well as Kenya say, yeah, it kind of calls to you to wash your hands. This sleek design. I think the color, we've had a lot of comments on that. In Asia, green is the color of like clean water, whereas like I've heard people say it's more going to be blue in other contexts and things like that. So definitely interested in exploring there. I think the tricky thing is that it is so expensive to invest in the injection plastic molds that go into producing this thing affordably at scale. So we're reluctant to do that unless it's really necessary. But I think that coming from this, we've had a lot of great experience in sub-Saharan Africa, like with these HappyTaps working, and then that's really fertile ground for us to come and say, oh, you've been using this for a couple of years. If you could change anything, what would you change? And then we get the $100,000 in financing to go make new molds, and then we can do little tweaks and adjustments to it. So yeah, good question. Thanks, Isaac.
Yeah. So another there's actually two more questions that I have, and then I can send it back to you, Sidai, if you have anything else to add. But there's it says, thanks for the great presentation. It's from Rachel Tembo, and she wants to know, how do schools ensure sustainability of the hand wash facilities provided to them? So is that any aspect of your programming? And then after that, I think there's also a good one from Ryan as well. So I'll let you maybe handle this one on the sustainability. You alluded to it in your presentation, but is there anything that you add as part of the package that they get beyond the product? Maybe just you can share some, or just share some insights on that.
Yeah, thanks, Rachel. I mean, the sustainability is a big question. So I think the reason why I stepped back into behavior change with my presentation is because I didn't want to come across saying that like infrastructure is a silver bullet, right? It's not just the path. You need the elephant, you need the rider. You need good school policies at the national level saying this is the minimum standards for like what we expect for hand washing. But of course, you need a good school director and good teachers, right? A great school director, they say you can tell a great school director when you walk into their school, right? It's not just the hand washing stations. It's like, what are the paintings on the walls? How clean is it? What's sort of the atmosphere that they create? And then so I think sustainability is so big in terms of the culture and in terms of the other support that schools are getting. We are very good at manufacturing a product and shipping it to where it needs to go, and then eventually setting up the local supply chains and local manufacture there. We're not as good as that sustainability, as that cultural, as that management sort of inputs as a lot of folks in this webinar. And which is why I'm really happy to be here, because I think it's partnerships with people that do specialize on sustainability, people like Rachel who are asking that question about sustainability that's going to lead to widespread adoption of technologies like this. So we're just trying to enable that and make it easier. And I would say, last thing I would say is that because the maintenance is so much simpler, I think that is an advantage that we bring, where your HappyTap, you can take it apart and put it back together as like, your 12-year-old. So, it's not like you need to hire a plumber to come in, which can be difficult, especially for, great principals in remote schools. How long are you going to wait for the plumber to show up? So we tried to make it as rugged as possible just to help facilitate that. Thanks.
Yeah, that's actually a really good point, because that was mentioned last week with Ghana. They were saying that, there were a lot of quick tippy taps and things set up, but they weren't robust. And so the question about robustness is definitely one thing to note. So I think we have probably time for Ryan's comment, and I think there's been a lot of reflection on everybody likes this idea of one per classroom. But the question is, I think I'm really on practical terms of if it's one per classroom and you have classroom sizes of 40 plus kids in some cases, how do you like manage that in terms of water and then the access to getting water? So I think that was just that. But you did allude to this, something around water, managing water use. So can you maybe talk a little bit about this question on the practicality, and then is there some feature in the design to kind of minimize or water use? Yeah, thanks.
Yeah, definitely. Well, I mean, first I'll say that, like, you know, my preference is a piped sink. I mean, that's what I use in my house. You know, I don't need to refill it or anything like that, but I'm lucky to live in a very water-rich environment. With access to running water most of the time. I do have a HappyTap for when we get the water cuts around Phnom Penh. The HappyTap was designed for water scarce environments. And one of the things that we realized would be a barrier to adopting this behavior is if people had to be constantly refilling their HappyTap, right? That was something that came up in early consumer studies. If you have to go refill it with water every time you wash your hands, it's not making it convenient and it's not making it very desirable. So we did a bunch of engineering on it. One of the things is there's this shower bar spout that's pretty wide. So it dispenses the water, not like a traditional spigot, which is good for filling up a water bottle or a cup, but it's about as wide as your hand. And so that spreads a good stream of water over the hands to help get the hands wet first and then help to get the soap off quickly. And between that and some other features that we've built into it, we estimate that you can get about 50 washes per refill of the 15-liter tank. And that, as far as we know, and again, the data is a little bit scarce, but that's very water efficient. I mean, if you go too water efficient, then you get a, you know, not fun hand washing experience. Like, you know, you've had those like low flow showers where you can't get the soap out of your hands, like imagine out of your hair, like imagine that for hand washing. But from like, it's designed to be, that kind of balance of a good hand washing experience, but also respecting the effort that people take to get in water. And now to Ryan's question, I mean, I'd love to sell 3, 4, or 5 HappyTaps to those big classrooms. That'd be great for my bottom line. But I realized that might not be realistic within their budget. So again, there is the water savings part. What I've done actually in schools where they don't have enough HappyTaps, play a game. We fill the HappyTap with water, and then we line up the kids. And I've done this with 48 kids. And the idea is you turn on the tap so it's constantly running, and you have the kids, they go up, they wet their hands, step to the side and get some soap. And then they go to the back of the line and they're washing their hands all the way to the back of the line, and then gradually every kid gets hands wet, soap, go to the back, hands wet, soap, go to the back. And finally you have the kid come to the front who's been sudsing his hands for however long it's taken to get to the line, and then he just rinses it, goes to the back, we're all behind him, rinses hers, goes to the back, and so we've got through about 48 kids washing their hands on one HappyTap.
I love
it. About 5 minutes, and so again, 50 washes. That's partly where 50 washes per refill is coming from. Because
and in a fun way
after that, but yeah, it was fun. And then I've heard other partners of ours do games to see who can, you know, get through it the fastest and things like that. I always caution against hand washing games where you're trying to do speed, because we all know we need to sing happy birthday at least once or twice, but the waiting in line aspect does kind of help to enforce that. So that's one thing there for those bigger classrooms too.
No, I see another one coming on how we can use games and fun to get kids and get even adults. I mean, I would even be playing that game. It's kind of fun.
Yeah.
Yeah, great. So there are a lot more questions and comments on the chat box. I know it's like you're in the West Coast, early in the morning. We can also keep them for you. But if you have a few, you're still, you know, not quite ready to get into bed, you give a few comments and questions. But on behalf of the WASH Network, I don't know if Siddha, you want to say anything before we let Roswell go?
No, all good. No.
Yeah, great.
No, I'm sticking around for the rest of the presentation.
Oh, perfect.
I had
Perfect.
Coffee, so, yeah.
Good. Okay,
yeah,
sounds good.
Everyone.
But I want to thank you for an excellent presentation. energizing, informative, and enlightening. And I love an elephant in the room will never seem the same to me again. So thank you so much, Roswell.
Thanks so much for having me.
Great. So now we move on to, I think we move on to Nairobi. So Samuel. I would like to introduce Samuel Langa. He works for Lixil and he's the leader of the Africa operations. Sam is an accomplished strategic commercial development leader and a certified coach with extensive experience spanning more than 18 years in both domestic and international markets, dealing with actually strategy and operations. And he's done everything from startups to work with multinational organizations. He holds appropriately a global business MBA, a postgraduate diploma in marketing, and I love it. My mother would too, a bachelor's degree in biochemistry. He is passionate about building a thriving African continent, socially sustainable, environmentally conscious way. So important now as we see what is going on in Kenya with climate change, drought, and everything else. So making it a reality in his role, he's here to share with us the award-winning social business of SATO and how he's been able to work with many others to empower and empower underserved communities so that they live safer and more confident lives. Beautifully, SATO was created in 2012 with the purpose to tackle the global hygiene and sanitation challenge and is within the pledge of Lixil, which is a huge one, but one that I'm glad they've taken, 100 million people to have improved sanitation by 2025. And we're behind you on that one. So the virtual floor is yours. Thank you so much, Samuel, for joining us today, and so looking forward to hearing more about this challenge we have ahead of us. Thank you. Welcome.
Thanks. Thank you, Belinda, and hi to everyone. It's exciting being a part of this call, and Roswell has really set the stage. I must applaud you for, the elephant in the room. I mean, it's hard to go after that, but I'm really happy because you pointed out a lot of the pertinent issues that affect us, not just Africa but globally when we're talking about hand hygiene, sanitation, just the whole wash space. So thanks, Belinda, for that great introduction. I chose to begin also with some context. Some of the great statements that we've had. I've just picked a few, and in relation to not just hand hygiene, but also hand washing, COVID, and the whole aspect of hand hygiene. So WaterAid, I'll pick this line from WaterAid where they point out that frequent hand washing with soap is one of the most effective ways to stop the spread of coronavirus. I know we're going towards the post-pandemic, but I know this is a behavior that needs to, really continue on because, we keep seeing the waves coming up, and just hand hygiene is really necessary, to experience, healthier lives. And stakes are higher in places where healthcare systems may be overwhelmed. During the COVID pandemic, we got to experience it, not just where the healthcare systems are stretched, but at home, because we all got locked. We all went back home and we were in the lockdown. And I keep saying that, we keep talking about it with just different people, that this is the time when, when we all realized how important it is to have not just a good toilet, but, the systems that we have at home, because all our families are with us, for some relatives, and you can imagine in higher densely populated areas, the strain when it comes to these facilities. I'll just pick one more on the product need. Hand washing facilities. This was stated by London School of Hygiene and Tropical Diseases, WHO World Bank, that hand washing facilities drive hand washing behavior. And Roswell has really, laid it out for us that, this hand washing behavior and the pathway is critical to not only having, the innovative solutions, but the behavior to actually wash hands. So with that said, I will skip this slide. Okay, rather I'll spend just a minute just to kind of just bring it together, because Belinda touched on what SATO is. So yes, we are an award-winning social business, but what I'd like to say is, we have a dual mandate. One is, to bring impact. Lixil has committed to impacting 100 million lives by 2025. But the other aspect is sustainability. And there's this, call for private sector players to come into, a space where it may be underserved, or it may lack, the right innovation, the right supply chain, the right the availability of desirable solutions and products. And so SATO really looks at not only the bottom of the pyramid, but we also look at those who are underserved. It could be low income. It could be just lack of access to either running water or access to a sewer line. And so we need to be able to do this sustainably. And so for us, we do have a model that both addresses the impact, but does it sustainably, so that the real desire is that we are here beyond the 100 million lives. And so to date, globally, we've been able to ship over 100 million units per year. And this is our third consecutive year across the globe. And when I say shipping units, I'm not just referring to toilets here, because SATO is known for the in the sanitation space, because this is where we started off with the SATO toilets. But we're also talking about now hand hygiene, which came to play at the onset of, or during the pandemic. So we have grown significantly, and we've shipped over 6.5 million units to over 44 countries, bringing impact to over 25 million lives. In the next slide, I'll kind of come into Africa, and because this is the space that I'm passionate about. This is the space that today gets me up in the morning. And in Africa, we know that the need is, they say that 40% of people globally don't have access to, to good hand hygiene facilities. And in developing countries, which is predominantly most of the countries in sub-Saharan Africa, we're talking of over 75% of this population not having access to to good hand hygiene facilities. And even the more when we're talking about schools, I know it's more than 60%. In some countries, it's even higher. So the reason I want to show this slide is because our model, when I talked about sustainability, we do manufacture, and you've heard from earlier that the challenge with with a business is in having that demand enough to be able to do that kind of the right investment, to be able to provide the innovative solutions and the resources to be able to just service, the demand and the need, across Africa, which is vast. And so for us, we have a model where we manufacture in 4 countries, 3 in East Africa. Today, we have manufacturing in Kenya through licensing, in Tanzania, and the arrows show which countries are being served by, the hubs. So in Kenya, we've been able to ship to Ethiopia and other different countries, Madagascar, Tanzania also we ship to Madagascar, and pretty much the sub-Saharan, the lower sub-Saharan countries. In Nigeria, we're able to serve countries within the English-speaking West Africa and also the French-speaking, the Francophone part of Africa. And our impact today is 1.7 million units shipped to date. We've shipped to over 16 countries, and this is very important because our all other products, whether it's hand washing or any other innovation, will have a quicker access to markets because of the existing established route to market and supply chain that has been developed through the SATO toilet. So it's a very important point, because this is what is going to bring accessibility to the hand washing innovation that I'll speak to today, and all the other innovations that are in the pipeline. We work with partnerships. I mean, this is really how we've been able to leverage resources. This is where the different partnerships have come in. There's an issue of behavior change. So as a business, for us, we focus on supply chain, sustainability in terms of providing access to the innovations and the solutions, working with the retail distribution network that allows these innovations to be closer to to whether it's the schools, the institutions, or the households. And this is this is important. To date, with our toilets, we've been able to, in the last 2 years, in fact, at the beginning of the pandemic, to work with 150 schools in terms of just upgrading their sanitation facilities. And this just sets the foundation and the grounds for, being able to bring forward, the hand washing facilities. And so as SATO, we are looking at a complete solution where it's not just about sanitation, it's hand hygiene. You can't have sanitation without hand hygiene. I mean, it's solving one problem, but then, we need people to have, safe environment. They need to wash their hands. So with that said, I'll jump right in and talk about SATO Tap. So this is the innovation that SATO was able to come up with, and we know, as I said earlier, the numbers are staggering. The 40% of the world's population, not having access to basic hand, hygiene facilities, and over 75% in the developing economies, and that's according to UNICEF. And to accelerate access, so SATO designed the SATO Tap. Which is unaffordable, and I like some of the points that were shared earlier. The affordability is very critical. You can see on the image to the left, this is the HappyTap. So you see communities actually striving through behavior change and through the work that's being done by the development partners, by the education partners to really drive that habit to wash hands. And this is the reality on the ground. So the SATO Tap is really that affordable, aspirational hand washing solution that's very versatile. I like the aspect of convenience, and it can fit anywhere in the home and for use, in communities. And it was developed during the COVID-19 pandemic, and Lixil, was able to commit to 500,000 of these SATO Taps to really just push it into the market to the households. I know there's a need for schools and institutions, but you can't, in this case, you would not say that you would have one and not the other, because these same children go back home, and if they have good hand hygiene in schools and not have it at home, I mean, it's a mismatch. And so I think the whole aspect of having access to hand washing is something that needs to be looked at holistic. So we partnered with different, we got together with different partnerships to just collect, the human, because it's a human-centered design. So we work with different partnerships, collecting not just consumer insights, behavior change, but also there was work in terms of advocacy and programming. And this is really to maximize that existing, public and private sector networks and supply chains to ensure that these innovations are accessible to not only households, but to the institutions. So we did get recognized, for the design because of its simplicity, minimal contact. It has the integrated soap holder, which we've seen is part of what motivates, behavior change, apart from access. When you talk about convenience, it is very versatile. You can move it outside your house, inside the house, and it could be potentially a game changer. And this is one of the things that came out of a conversation with UNICEF, that it could be potentially a game changer for hand hygiene at what we call bottom of the pyramid, communities that lack access to running water and the scarcity of water. So just to help everybody understand, there are links to, and I'll share the links to our YouTube page, because that's where you get to see actually how it works. And what you see is, greater than, images. It does have a water saving technology. It works very simple. So it has what we call a tap, but it's a nozzle that you tip with your elbow to the front, and it causes the water to run down to where the point where you can access and wash your hands. I'm in a meeting. Hello?
Yes, Sam, we are with you.
Oh, sorry.
That's good. That's great. No problem.
So really sorry. Yeah, I dropped off for a minute.
Yeah, that's okay, but no problem. We're back with you. If you maybe we have a couple minutes. There's quite a lot of questions and comments too. So this is great, very interesting. Please continue.
I'm about to wrap it up.
Yeah, no problem.
Yeah,
Perfect.
I'm about to wrap it up. So these are the features and benefit summary, and some, they really touch on, the motivation for whether it's behavior change, and also motivation towards, the human-centered design. What are the, what would people be looking at in terms of, getting access to, a place to wash their hands, and also in terms of the design, so that it's easy to use. One of the great aspects is the fact that when you see the HappyTap, it uses bottles that are existing. So one of the things that was built into the design is what is available within these communities. One of them is that water bottle that gets reused. So it works very uniquely because it's that same water bottle that the households would use with the HappyTap, but now we have one that is more robust, something that was mentioned. It's affordable. It's readily available through the supply chain channels that we have. With the toilets, now we have the tap going through the same channels. So not only do we have water saving and the unique design, but the aspect of affordable and aspiration is very critical. Yeah, so this is just a representation of what happened during the pandemic. We got to test it. Where we do have installation of toilets, we also have the hand washing, and this is someone who's very happy to celebrate that completes that holistic sanitation and a place to wash the hands. And then the rest assured, the versatility. It can be used in marketplaces where it's similar to the HappyTap, where you have a hole and then that's how they wash the vegetables and wash their hands. So this really replaces that access to a better way to wash their hands. And then there was a report that was done, a rapid assessment with the help of UNICEF, to establish whether there's acceptability, whether the pricing would be right, and whether the communities would gravitate towards investing in a hand washing solution, the SATO tap. So this is a very important slide, and I can skip the rest of the slides. So what next for SATO tap? It just doesn't end up with the households and the 500 units that were shipped out globally during the the pandemic period, of which 140 was in Africa in 7 countries. But now SATO tap is available locally in Tanzania, and we're looking at making this available in Kenya. The options of manufacturing in West Africa is something that's very critical. Of course, the investment outlay has to be looked at, but because of the cost and because of the existing technology we already have through our licensed partners, for us it's a plug and play, because it's it's the same machines that are already invested in for making the toilets. And really, this is a first step to develop that sustainable, providing available products, and also a sustainable retail market, that just allows the households and the communities to have these accessible and acceptable innovations. Now the technology team is working on options, because this is what came out from the market. So there is acceptability in terms of the existing SATO tap. The question is, or rather the push now is for us to innovate a bulk approach to hand washing. And some of the thoughts around this is the same tap, the same benefits of the SATO tap, of water saving, the issue of cross contamination, and limiting, minimizing that contact with the tap, and just connecting it to to a holding tap, I think would be an excellent consideration for what we'd call the bulk hand washing option. So this is still in the pipeline. I don't want to overcommit, because it takes there are all these aspects that need to come into place to ensure that it's either affordable, it can be manufactured locally, and it and it meets the investment criteria. So with that said, I know in the interest of time I need to turn it over back to Marge or Belinda so that I can have any questions.
Great. No, Samuel, again, thank you very, very much. And please continue to share the slides. Keep the slides on so people can see. There was a question. I think you mentioned you would send some of the links on your website and also the YouTube. And I think if you actually can share some of this, we will love to have the presentation so people can see it as well. I'm going to turn the floor now to my co-moderator. If maybe you want to share some insights on this presentation. Thank you.
Sure, just I'll be quick because I know we're running short on time, but thank you, Samuel. And one thing I noted in the beginning of your presentation is how you said facilities initially drive hand washing behavior, and it made me think of how usually facilities can be an entry point for hygiene or other types of wash interventions. And this was in our region, it was well illustrated in Guinea-Bissau, where they introduced a low-cost foot-operated hand washing machine, which was well liked and well received by this was in healthcare facilities, but so by the workers in these healthcare facilities, and how that was was used as a drive to then push for programs as they relate to healthcare facilities. And maybe, I mean, this is maybe just more of a reflection or question. I mean, private sector engagement in the realm of WINS has been, I think, a bit less dynamic than households for obvious reasons. And so I just wanted to maybe turn it over to you in terms of like, what are some of the challenges? Because you talked about how all these things are interconnected. Schools are not separate from communities and from other institutions. So what are some of the challenges around that, and some maybe initial ideas around addressing it? Yeah, thank you.
Thank you. Great question. So I was taking notes also as Rosal was talking, and I was trying to see where the overlap is, and pretty much everything. So the aspect of really available, acceptable, affordable solutions is one challenge, right? And then the second challenge is the maintenance. I think that's critical. But the most important one is budgets. We've seen, I mean, we have a school toilet enhancement program, and we've seen the challenge in actually, releasing budgets and prioritizing, whether it's hand hygiene or sanitation. I mean, we've seen the limited budgets going towards, providing books and, some of the infrastructure like, classrooms. So yet also the, just these budgets being released and being utilized, especially with, the local governments. So there is a need for that kind of approach, where we're looking at budgets. How do we supplement the schools? How do we, address this huge need? Because if we do look at, available funds from the school budgets, I don't think we'll be able to sufficiently address, hand hygiene and all the other challenges that the school has. So that's, I'd really put that out as the top main ones. Yeah.
Thanks. I see actually a question, if I can add in, from Chaive in Zambia. Chaive, you are welcome to unmute if you want to even show the video. You're welcome also to ask the question, and I'm glad that you're joining. Chaive, as many might know her, is the moderator for Sustainable Sanitation Alliance, and amongst other things that she does. So Chaive, please welcome. Can you share your question, unmute and share? Thank you.
Thank you, Belinda. Wow, what an amazing presentation from both earlier presenters. It's great to see a lot of progress in the hand washing space, and particularly around COVID. Obviously, when we look at a pandemic, there is a lot to do with scale. And that's usually a challenge in the sense of, innovative approaches and trying to get the market ready, while the communities are struggling with the lack of facilities as a result. So just in these discussions, are we also looking at how locally driven innovative approaches have worked? Is there any thought around that that are driven by the communities themselves? I know in the case of Zambia, there were cases where the communities started to respond to the market on their own. They were developing their own hand washing facilities. The welders and the plastic fabricators came together and actually owned these innovations. So what does it look like in that regard with respect to WIN and other players in the market, and how they perceive this aspect of community-driven innovations?
Yeah, thanks. That's a brilliant question and comment also. So innovation happens every day. I mean, this is the experience we've had by engaging and by connecting with the communities, and people will always aspire. In the rapid test that was done by UNICEF, one of the things that was given is that trade-off. Would you trade off money for the hand washing, the SATO tap? And overwhelmingly 99% of the people wanted the SATO tap as opposed to keeping them or getting money instead. And then you've seen tippy taps. I mean, that's already an aspect of innovation. I talked about the food vendor lady who has a bottle and the cap is perforated. So there's always that desire to aspire. And I speak not only for SATO, I believe I speak for many innovation driven companies, that this is one aspect that really gets built into that human-centered design. What is that aspiration? And in some instances, it goes beyond even affordability. If really these unique solutions that are human-centered are presented to the communities, they would gravitate towards it. Looking at, wins, I mean, we saw companies that would not conventionally come into the wash space do so. I mean, companies that did not had no connection with making hand washing facilities get into that business space, traders get into that space. But that's because there was this demand and there was this awareness that drove people to really ask for this hand washing innovations. So yes, there is, but I feel this this is a space for the private sector to really come in and support these communities to have better innovations, and incorporate some of those ideas from the communities into the design.
Thank you, Samuel. Sadai, before we close this part of the session, any last reflections, or are we good to move on?
We're good to move on.
We're good to move on, yeah. It's super enlightening. Thank you, Samuel, so much. There's still a lot of comments and questions. And I see that you're putting links. This is chat, learn, and exchange. So I thank you very much and continue to respond to those comments. And moving along, so we've gone from individual hand, then we've gone to SATO, which is now looking at was individual hand washing, but now is looking at how they can maybe transition to more group hand washing. Now we get to the group hand washing. So very pleased to connect with my colleague and also great WASHaLOT advocate and expert. Great to have you here, Fred. Fred is the WASH advisor for GIZ School Fit for School program. He has expertise in design, production, implementation of group hand washing facilities, and specifically the facility he's going to speak to today. He's been involved also in the training materials because it is a very important part of this, the training targeting the stakeholders for the production of the WASHaLOT to ensure that you get a high quality design. He's also very busy and involved in the development of the O&M, because we've talked a little bit about the importance of O&M and how it links to the facility. So he's very much part of that to ensure the schools are managing these facilities and actually as part of the WASH program. Important to this is also tools for costing and management support. And Fred works alongside Marge and others on the WINS Network Secretariat, and importantly, the website management, which keeps all this information and keeps us all very knowledgeable. So thank you, Fred. The virtual floor is yours. Take your time. I think we're very interested in this, and so take your time and thank you. You're welcome.
Thank you for the kind introduction, Belinda. Let me just wait a bit, cause let me share my screen. Screen. Where do I find? Nope. This is not the one. Sorry, just a bit.
No worries. As you're doing that, just please keep your questions coming. Questions and comments. Both Sam and Roswell are on the call still and are answering them. So feel free to share. And also, as we go into Fred's presentation, please share your questions and comments. Perfect, Fred. I think we saw the screen there.
Wait, I'm having a technical difficulty here.
Oh, okay, no problem. No problem.
Wait, it should pop out now.
Yeah, no problem. We're all good.
Sorry. And actually, a power interruption interrupted my connection earlier, so I was hoping
it wouldn't do this.
Yeah.
No, it's absolutely all good. We just getting the presentation on, still encouraging you to put your comments and questions. And maybe Marja Piata can backstop a bit.
Or maybe you can it can be presented from Piata's end. That would be pretty helpful.
Yeah. Okay, yeah. Okay, and I also didn't mention, I think Marge mentioned, Piata is on backstopping us. Oh, she's a star. Thank you. Save the day. It's over to you now.
Thank you, Piata. Wait, let me just go back to that screen. Yes, thank you for that warm welcome, and really sorry for this brief technical interruption, and hopefully my internet will not fail me this time, and also the power interruption. We just discussed earlier, touch on a bit on water scarcity, but yeah, just to tell you from my side, we're also experiencing power scarcity in terms of stable power connection. So yeah, as you mentioned, Belinda, I'll be sharing with you a design of a group hand washing facility, and also really thank you for a very how do you call this, interesting presentation from our colleagues earlier, who really set the floor on importance of high behavior change, convenience, making hand washing easy, and also touching upon on the importance of looking at sustainability and operation and maintenance aspects. So these things I will not much dive into, because my presentation really focused on the design of this the hand washing facility technology called the WASHaLOT, and I will also bit by bit touch upon on these things, and maybe later in the Q&A part we can really get in depth on onto those parts. Next slide, please. Next slide. Yeah, so as I mentioned, the WASHaLOT is a hand washing facility designed to accommodate a group of individuals to wash hands simultaneously, and this is specially suited for schools to manage hand washing for a large number of students while making it a fun activity. So earlier, I think Roswell mentioned also the idea of making hand washing and individual or group hand washing activity itself as a fun activity to also encourage formation of this behavior, no, while in different contexts. So the technology debuted in 2017. The WASHaLOT is the third iteration of the design that was developed by the Fit for School, which I'm part of, in collaboration with the Sector Program for Sanitation, Sustainable Sanitation, or SUSANA. And since then, the technology has been implemented in parts of Asia and also parts of Africa. Next slide, please. There. So before we go to the technology itself, no, and the key features, I would like just to briefly touch upon the main components of the WASHaLOT as the basic components. No? So as you can see in the photo, we have I just delved into three main parts: the main pipe, the water outlets where the water is being dispensed, and the legs and post. So for the main pipe, this is actually the idea of the technology. Actually, is utilizing the pipe itself as the main water reservoir. And in terms of durability, from our past experience, as I mentioned, this is the third iteration already. We for the main pipe we used high density polyethylene material that can last longer under constant or continuous exposure to sunlight. Sorry. Sorry about that. That's my baby. It's lots of interruption here, but
No,
yeah.
I love it. I love it. For me, honestly, no, it's great. We talk about children, we talk about washing, and I love it. I think it's perfect. Keep going.
Yes. Yeah. So so the next main component of it is the water outlet. I would dive deeper on this later, but the idea of this water outlet is that it's a mechanically operated one, and it automatically closes once the user that is washing their hands on it is done. So whenever they remove their hands or they're done with hand washing, the water outlet automatically closes. Think of it like a mechanical or a small scaled version of a censored one, that is a censored water faucet that is found usually in malls or high fancy hotels. So yeah, and lastly, the leg or the post, it can be either a mobile design, as you can see in the photo. This is a mobile leg of the mobile version of the leg of the WASHaLOT. And there's also a variation wherein the leg is instead of a leg, it utilizes of a post so that it can be installed permanently in an area. For example, along the school entrance, and or for example in front of classrooms. Next slide, please. Sorry. Yeah. So now, how does it work? With its mobile nature, it is easy to set up in any given area and can be used independent if there is existing pipe water system, as it can be refilled manually. But for areas where there is an existing pipe water system, the WASHaLOT can also be connected directly. So it also provides an avenue or option, for example, for schools where located in hinterland, they can operate. School can just fetch water from a well or groundwater, or students can bring water. Then they can use that for hand washing. And if schools like on highly urbanized areas, they can automatically connect it to existing pipe water systems. And in connection again to the mobility, of the WASHaLOT, the WASHaLOT can be set up near existing drainage or a gravel bed with adequate inclination to direct sewage to a drainage canal, rather. So yeah, so there's a variety of ways you can actually install or make use of the technology. Either be just looking at your specific budget, or if you have huge budgets, you can actually put more into it. Next, is this the next slide? Yeah, so this is slide. So in order for one to wash their hands on the WASHaLOT, one only needs to push the lever on the side so that water will flow. And once the hand is removed from the lever, the water outlet automatically closes to prevent water from to be wasted. So this is the point where actually I mentioned earlier that it is kind of toned down version of a censored operated hand washing facility found in hotels or malls. And in terms of water capacity, the entire WASHaLOT, there's actually a long version and a short version of this one. The long version can hold up to something around 25 liters. That is good for 150 hand washing activities or persons that can wash their hands. And for the shorter version, it can accommodate up to 80 hand washing activities. Next slide, please. So the key features. I would touch a bit again on the automatically closing water outlet. No, so the nature of this valve, water valve that we use for the WASHaLOT is that when you push the lever, it only dispenses water when you push the lever, right? And then you can wash your hands with that one. In a way, in that mechanism, while you were washing your hands, it also washes off the valve itself. So it's, in a way, it cleans itself as you actually wash your hands. And then, as I mentioned earlier, it has a very minimal water consumption, up to 20 to 30 ml. If I'm right, 20 to 30 ml per student. Per hand washing rather can be managed for the WASHaLOT. And again, the mobility aspect of the WASHaLOT, that you can actually, for example, in emergency cases or as a response, or like for example, again in this pandemic, you can actually stack up a couple of these units, and then once you can just actually distribute it and have them deployed easy and fast to your target areas. Next slide, please. Key features. So again, going back to the point of Roswell earlier, the convenience and making hand washing easy. That's looking at the user's perspective. In the whole idea of behavior change and instilling hand washing habits, you would also need to actually look at other players, like for example, the one who runs, or the teachers that manages these activities. No, so you would also make sure that in their perspective, the facility that would be provided, or at least be used in their area, is also easy to maintain, and how do you call this, low cost also to operate. In terms of another key feature is its compact design. It does not involve any too many parts or moving parts. That is also contributing to its durability aspect. The less components you would have, that is also the better in terms of operating, maintaining these facilities. And as to the point of scalability, the idea here actually is to really come up with generic design, and then it's and also setting up production sites, local production sites, so that whenever, for example, the Ministry of Education, or for example, the Ministry of Health would like to implement or make use of these facilities, they can already we already have local producers that is capable to produce this in the quality that we wanted and the specifications that we wanted also. Next slide, please. Yeah, so what about the WASHaLOT during the pandemic? So in my first slide earlier, the cover slide, it shows a picture of the WASHaLOT pre-pandemic, wherein many kids can really wash their hands. The long version can actually accommodate up to 20 students at a time. The short version can accommodate up to 10 students at a time. But for example, during the pandemic, there's you can actually the school or the target audience can actually alter the or put in nudges into the WASHaLOT that they can make use the WASHaLOT in a physical distance manner, following health protocols in different areas. Next slide, please. So yeah, I've mentioned earlier that setting up local production is also part of the whole agenda of setting up healthy environment. No, so the part of our project is to also have local companies in our areas. For example, in this case, Indonesia and Philippines, and identify them, and together with the program, we set up production assembly line, and also include quality assurance protocols in the whole assembly line. Another aspect, aside from setting up the assembly line itself and also incorporating quality assurance protocols, we also made sure that the raw materials that will be needed for the production is actually available or locally present, and to see whether if these materials, raw materials, actually met the required quality assurance in terms of, like, for example, stainless steel, HDPE materials, because we know there's a lot of substandard materials out there. So in this collaboration with these identified local producers, that's also included in this capacity training that we went through with them, no, to set up this local mass production sites for both Philippines and Indonesia. And I'm happy that during this pandemic period, and also in those collaboration in both countries, we have produced, the two companies have produced actually a combined of 2,000 units WASHaLOTs that was distributed to different schools in Indonesia and Philippines. Next slide, please. So yeah, as I mentioned, distributed to schools to be installed at school entrances as a support the efforts of education ministries of Indonesia and Philippines in slowly resuming face-to-face classes in schools. And as you can see in the photo, a good chunk, or I think most of the facilities or the hand washing, the WASHaLOT that was provided to the schools were intended to be set up at school entrances to actually support the ministries of education in slowly resuming face-to-face classes in a safe manner and also following required health standards. Next slide, please. So I'd like to direct your attention into this recently published material. We call this the WASHaLOT Knowledge Map. So this publication is a collection of documents providing general information, guidelines and manuals, webinars, studies, and technical instructions for the WASHaLOT. Just to make mention this, the WASHaLOT is not a company. It's an open technology which everyone can access and really look upon, and they can copy on their own. And with this knowledge WASHaLOT Knowledge Map, you can actually find videos, technical designs where you if interested organizations would want or would like to implement the WASHaLOT technology in their area, and then use what is already available and set up local producers there. And yeah, so basically we can also, this knowledge map really captures the entire experience of the WASHaLOT from its inception way back 2011, from the first design, second design, and up to the third design. It would be also really good. And I'd like to make mention also in terms of applicability, the studies that were conducted for the WASHaLOT. It's also very interesting, wherein the WASHaLOT was also used or implemented in healthcare facilities. And there was this comparison that actually the idea or the design of hand washing facility that you're gonna use should also consider the context where this facility will be used to. It can be like, for example, the WASHaLOT really thrives in the area, in the context of school, because group hand washing activity can be done there. It can be set up, like, for example, policies can also set up, school management is clear. But for example, for healthcare facilities where your target audience or the people that comes into these healthcare facilities is not like as regular as compared to students, no? So in terms of behavior change or getting them to wash their hands is kind of tricky in terms of making use of the WASHaLOT. So the idea here is just the WASHaLOT is not a silver bullet to answer the challenges, but the WASHaLOT offers its an opportunity or a solution to certain problem that might be a reality to other areas. So
Fantastic.
that I would end my presentation.
Fantastic. Thank you very, very, very much. So I guess there is a lot of questions in the chat box, Fred, so I'll ask you to kind of look at them. Particularly, I draw your attention to the question from the other Fred Nimambara, who has a question as well. And then Charles also has a specific question. But I guess in the interest of time, what I would like to do is invite Sidai to maybe share some of the insights, overall insights on this, and if there's any other questions, to give the floor to you. So yeah, so we can just move along. And I do appreciate people staying a little bit longer on time. So Sidai, the floor is yours if you have any sort of general overall insights to share on this session.
Thank you. Thank you, Frederick, for your presentation. So I was just looking, I mean, this is bouncing off of discussion between Bella, Samuel, and Maya in the comments where they were exchanging on collaborating with the Ministry of Education. And just to maybe, if we could just talk a little bit more about how we can best support national governments and WINS coordination bodies with calculation and procurement costs, because I think that's one area of focus that we'd like to move on in the region, because we're missing a lot of information and data on costing. So that's one. And then the other, I mean, this was more of a question on with regards to operation and maintenance, and what are the operation and maintenance needs that could arise with WASHaLOT, and does it need, or did it need specific training of local manufacturers, or, you know, repair persons in instances where local production, so in this case Indonesia and Philippines, if I remember correctly. So thank you.
Yeah, just to, do I still have time to answer?
Yeah, absolutely.
Yeah. Just to answer that directly, the question on the is there what kind of foreseen operation and maintenance? No, the WASHaLOT just works as a normal hand washing facility. You would need to refill water of it. If you do manually refilling, you need also to clean it, because like for example, algal accumulation to water vessels exposed to constant sunlight, that's really that's a normal phenomena. So you would need to every now and then clean these facilities, and that might also be true to other hand washing facilities, no, group hand washing facilities. As for the if you would the question as to would you need a specific training as to actually operate, maintain, and repair it? The as I shared earlier, the design of the WASHaLOT actually also takes into account the management aspect of it. So in terms of basically it's like a plug and play facility wherein the school can easily assemble it, easily operate it, and can also, with the help of a manual that goes together with the hand washing, with the WASHaLOT, they will be able to troubleshoot common problems of the WASHaLOT. There's only a need to actually train and really come up with strict quality assurance protocols in the production side of things, because if you don't put emphasis as to the technicalities of that, the problem would then be turned to the school, and you don't want that to happen, because the idea is that you want to make it easier for them, and also considering that they don't have this local expertise around. So you need to solve potential problems already in the production side. So that's why a huge emphasis on really looking at technical specifications, standards of raw materials used, setting up quality assurance protocols, so that every WASHaLOT that goes out of the production site really passes the standard that we set.
Thank you. That's a really great point.
Yeah, fine. And Sidai, any sort of closing insights on the all three presentations, or is there anything you would like to sort of reflect on as we close?
I feel put on the spot. I mean, so many things to put together. I know. No. I'm happy to. Yeah. No, I think overall it's been inspiring, and it's great to see all these different designs that respond to, I think, a range of needs come together. So I think that if anything, this just leaves me with food for thought as to how do we approach these different actors, and also how do we approach, I mean, I think just overall, I think it's just an invitation to be more open to exploring what's out there, because I think some of the, I think we have a way of working which to take these traditional paths, and this is just a reminder that this is a dynamic, growing space. And yeah.
Love it.
Thank you.
Love it. That's perfect. I think you ended it in a most beautiful. It is a dynamic space and it's growing. And I think for me, what also brings to thought is perhaps more discussions on this, maybe an international learning exchange on private sector engagement on hand washing and hand hygiene and the bigger work related to that. I mean, we see how potentially designs can actually address some of the issues around sustainability, robustness that can be built in the design. And I think we also look at a location of the facility can also increase behavior practices. I think the real question comes to, and I think this is the one probably, if there's any people who are in the behavior space, is how do we move from it being an emotional thing, I'm excited to wash my hands, it's a game, to become unconscious behavior that people are doing all the time. And again, I think this continues to be questions, all the questions around policy, all the questions around budget, all the questions on implementation arrangement are there. But bottom line is, just like we grab our phones in the morning when we shouldn't be, how do we get into this unconscious behavior space? And I think that's kind of where we need to go with hand hygiene. And if we can do it in the early years when we're in school, these beautiful growing minds of young people, this is a lifelong global public sector health protection and gets kids in school. So I want to thank all the presenters today. Roswell, who maybe still up with us, Sam, who's staying warm in Nairobi, and also Fred in the Philippines. Thank you guys so much for sharing. I think there's a wealth of knowledge, a wealth of space in this space, and we hope the conversations continue. So with that, we send it back to Marge, and yeah, we can close the session.
All right, so Keta, may I request you to share that one last slide we have, although I've already placed the link in the chat. So yeah, all right, just a few closing words from my side. Well, first, thank you very much, Belinda and today, for the excellent moderation, for the beautiful closing parting words you've shared. And yeah, we've had a really engaging and rich discussion, and you've provided very insightful sharing in between and to close. So thank you so much. And to all our presenters, Roswell, Samuel, and Fred, thank you very much for the interesting and informative presentations shared with the audience we have here today. And of course, thank you to all of you here for participating, for sharing your thoughts, and for staying until the end of the session, although we've gone a bit over time. Thanks for staying. And yeah, just a few
and Sarai, I just want to also thank Sarai.
Yes, today, yes. Yes, thank you so much today. Yes, we really appreciate all of the insights you've shared during the session. And yeah, we'd also be very happy to hear from you, our participants, what your thoughts and feedback are on this session, as this would greatly help in the improvement and the development of future webinars. So in the chat, there's the link to a very short survey form, which will take roughly 2-3 minutes of your time. So we really appreciate you taking the time to provide your responses, and I'll also follow up with an email to share that same link. So many thanks in advance, and we look forward to catch up and continue the exchange with all of you as a member of the WINS Network. So once again, on behalf of the WINS Network Secretariat, thank you very much for your time and attention. Take care and goodbye. Thank you.